This is Mike Tatarsky with the new episode of the Vietnam Weekly podcast, and I'm joined today by my friend Beth Lopez, the co-founder and CEO of Docosan. So, Beth, I'll let you introduce yourself and Docosan a bit more.
Hi, Mike. Thanks so much for having me. So, Docosan is a health tech startup based here in Ho Chi Minh City. The name Docosan is a mixture of English and Vietnamese words. Doc is in doctor, and Co San is in available in Vietnamese. And that reflects our mission to transform the way that Vietnam's middle class accesses healthcare for the better. Our digital marketplace lets patients easily compare doctors based on quality, location, and price, and it massively expands doctors' client bases beyond word of mouth circles.
Yeah, and it's both a website and an app, right?
Right, so there's an app for doctors, an app for patients, and it's all fully web optimized too.
Gotcha. Yeah, and I've used it a few times. It's been great. We'll get into that a little bit more, but kind of like you a little bit personally first. How did you get into public health or working in health?
Well, I think I've always been interested in healthcare. My undergrad was in biochemistry, and I wanted to go into medicine, actually. And so after I graduated with my undergrad, I joined the Peace Corps because I wanted to get some more practical experience. And they sent me to Cambodia. So back in those days, you couldn't choose the country that you went to. And I didn't really know anything about Asia or Cambodia. I knew where it was in the map, but nothing else beyond that. And so I worked as a community health worker in rural areas in Cambodia for about 3 years. And I absolutely fell in love with Cambodia, the ASEAN region as a whole. And it really changed my perspectives on healthcare. So poor access to healthcare was not caused just by a lack of doctors, but there's so many factors that go into it. For example, where I lived, there wasn't clean running water. And so a lot of the little kids had a lot of gastrointestinal issues and things like that. A lot of people from the neighboring villages had to travel pretty far on dangerous roads where there just wasn't road safety. People weren't wearing traffic or seatbelts and stuff like that. So road accidents was a big thing and a big cause of mortality. And so I saw that it really was public health that determined whether someone had good health care at the end of the day. And so after I finished working in Cambodia, I decided to pursue this career more in public health instead of medicine. I went and got my master's of public health at Harvard, and then came right back to Southeast Asia after that, and I've been here ever since.
Yeah, and then when did you move to Vietnam again?
To Vietnam, it's been about a little over 3 years.
Okay, gotcha. So what led to the decision to start Dakosan?
Well, I couldn't find a doctor for myself, was the first thing. So,
Okay.
yeah. So I just needed to get an IUD removed. I Googled and I found the hospital with the biggest marketing budget, basically. I went to the hospital, did all the check-ins, and then I was told to come back after COVID. So as we know now, there is no after COVID. I would still be waiting. And so it's just so difficult to navigate healthcare here. And I'd previously worked for a Singaporean pharma tech startup as a market launcher, and that's what brought me to Vietnam. That's 3 years ago or so. And I launched their app for pharmacists here, and within a year, it had grown to 1 in every 3 pharmacists in the country were using the app. And so I saw this huge opportunity. It's hard to find the right doctor, let alone know about like the quality and price in advance. And Vietnamese people are so digitally savvy. Everyone is doing everything on their smartphones, like ordering taxis, food, paying bills, trading stocks. But the healthcare system is largely offline and fragmented. So it just made perfect sense.
Yeah, and I mean, and what was it like starting it? I mean, how did you? Obviously, there's kind of two sides of it, both the doctor side and the patient side. How did you get off the ground? How did you find? How did you get buy-in from doctors initially?
Right. So, I mean, there's a lot of different advantages and disadvantages of starting here. And I guess like some of the main advantages are there's great tech talent. It's really easy to find engineers, and they're quite skilled. There's a digitally savvy population, and there's tens of thousands of private clinics and hospitals who are competing for patients. So it's quite competitive. There's over like 50,000 clinics in the country. So those are some of the factors. Okay, so for disadvantages, like I mean, people are still not used to the idea of like booking appointments and doing healthcare digitally. So it's still a new
Okay,
concept.
sure,
Even
sure.
old school appointments, even those old school appointments are not really a thing for most people. But that's what makes it a game changer. people can change their behaviors in mass the same way as when Grab joins transportation. So it's hard to imagine calling a say Om off the street anymore, haggling a price, struggling with the directions. So in the future, it'll be just as intuitive with healthcare.
Okay. And I guess at this point, maybe for listeners not in Vietnam or less familiar with the healthcare system here, kind of how does it work basically? I mean, you're mentioning, doctors in private clinics or public. How does that kind of work in a general sense?
Yeah, so there's a big public sector as well. There's fantastic quality of doctors, both in public and private sector. The public sector team sometimes can be a little bit overwhelmed with just the sheer volume of patients. And so it's not uncommon to see big crowds of people waiting in line to get to see a doctor there. At the same time, in the private sector, you often have literally like the same doctors as have practiced in the public sector, but the clinic might be empty during some hours, even with very senior doctors. And so it's just all about like how discovering the right place to find the right doctor. Because
Right.
there's no
Okay.
information on it, right? Like you don't know about the quality of the clinic across the street. You sometimes you just don't have the right information if they offer the service that you need, or if the doctor speaks your language even.
Yeah, definitely. Or I mean, even to know to look to places like I mean, I went to City International Hospital, and which is pretty far from my house, but for a procedure that went really well, and I would have never even thought to look there if not for Docosan, and it was much more affordable than
Yeah.
I'd been quoted elsewhere. Um,
Yeah, I mean that's the thing. Like there are fantastic providers like all across the city. So one doctor in particular, it just kind of blows my mind about his clinic. So this doctor, Le Cat Bao, he's a pulmonologist. He did his Fulbright. He did a Fulbright degree at Harvard. And so like he's got this kind of like world class like qualification. He's also a professor at the University of Medicine and Pharmacy, and he's got a private clinic. But you wouldn't know about his private clinic unless you had seen him before, basically, or you'd heard from one of his other patients. They don't spend a lot on digital marketing or advertising. And so, yeah, you can go and get a consultation with a world-class pulmonologist for it's like 250,000 Vietnam dong, which is about 10 US dollars.
wow. Yeah.
Yeah.
Yeah, and certainly for foreigners, that's obviously a huge help because, like you said, if you Google, kind of the same places will always come up, and the care I'm sure is good, but the prices are high, even if you have insurance. But what is initially, how did your team approach doctors, or I guess doctors and patients? Like you said, people are a little unfamiliar with booking healthcare online, perhaps, but how's that kind of initial approach?
Yeah, so ours it's a digital marketplace, and there's two sides of that marketplace. And building marketplaces is sometimes wickedly difficult because the doctors don't want to join unless you already have a lot of patients, and of course the patients aren't going to join unless you have the doctors that they need. And so when we got started, we had initially worked quite closely with some doctors over at the University of Medicine and Pharmacy. So one of our advisors, Professor Ang, he works in family medicine over there, and so he kind of like guided us, and we got a lot of our initial users who also happen to be very senior qualified doctors just through this initial kind of testing phase because I think they're academics, they're curious about this new intervention that we were doing, and I had just known them from my work before. And so then after we had quite a few senior doctors on our network that had joined early on, other doctors saw that, and the medical community is pretty small in Vietnam. They all kind of know each other more or less, and you see some senior doctors in the network, and you say, "Oh, I would like to join this too." And so, kind of starting at the center of excellence with these professors at the University of Medicine, we were able to expand our doctor network from there. And of course, if you have great doctors, then the patients will follow too.
Right. Yeah, that makes sense. um, yeah, and then so when did the website, like when did your service go live again?
It was in April of 2020.
Okay, so I guess fortuitous is a strange word to use, but that was basically when the pandemic was really getting going, both here and globally, of course. So I guess kind of what impact have you seen from the pandemic, either on user activity or doctor doctor views of the service, or what have you kind of seen over the last year, I suppose?
Yeah, so I mean, the company began operating basically during the pandemic, so it's not new to us. And I think we've been able to thrive in that environment rather than suffer. And so what it means today is that we offer telemedicine appointments so patients can easily video chat with the medical professionals, and it reduces in-person contact. And even the online booking angle is something that makes sense during a pandemic, because you don't want to wait in a crowded line when there's a risk you could catch COVID from someone else. So I think, at least in the healthcare sector, I don't want to say like positive because, but it's changed people's behaviors in a way that has enabled like patients to be more open-minded about trying new technologies, and the same thing for the doctors too.
Right. So kind of building off that, I mean, you see, I imagine, quite a bit of data in terms of what's going on with bookings and types of treatment and clinics and that sort of thing. Are there any kind of trends you've noticed that, I don't know if anything has surprised you, or anything that maybe is just of interest in terms of what people are looking for, or what, what's most common, or that sort of thing?
Right. So we have a whole lot of bookings for mental health and sexual health in particular. And it's something that makes sense. Like, the main way that Vietnamese people find a doctor is through word of mouth. Like, they'll ask a friend or family member, where do I go to find, the best pediatrician? Like, how did this doctor treat you? And that's kind of how they discover the doctors. But with things like mental health and sexual health, they're really stigmatized. And it can be difficult for people to discuss that with friends and family. But they're Googling it, they're looking online, they're looking for the right provider. And so it just made sense that they would use Docosan to find those kind of services. And so a trend that I hope that Docosan especially plays a large role in is in having digital interventions that destigmatize sensitive areas in healthcare, like mental health and sexual health.
Okay, yeah, that's really interesting. That hadn't crossed my mind, but that does make sense, because, like you said, there's definitely hopefully changing a bit, but certainly a stigma to some extent around both of those areas.
Right.
And then, so I imagine most of your doctors are probably in Ho Chi Minh City, but what kind of is the distribution like around Vietnam?
Yeah, so we're in Ho Chi Minh City, Hanoi, and Da Nang, and we plan to expand to second-tier cities within this year as well.
Okay, nice. So how many doctors are on the network right now?
There's over 600 on the network, and they're across
Right.
30 different medical specialties. Yeah, so kind of no matter what kind of issue you're having, we probably have a doctor for that.
Hmm. Okay. And then, so I mean, you mentioned kind of expanding to second tier cities. What kind of other growth or goals do you have? I know you've also gotten some investment this year, which is congrats on that. But yeah, where do you kind of see Dakosan and maybe health tech in general kind of going here in the near future?
Right. So I think in the future, we need to go beyond digitalizing the existing healthcare experience. It has to be something even more different. So what DocuSign wants to do is be the connector for the whole healthcare ecosystem at the press of a button. So not only finding the right doctor, maybe you do the telemedicine consultation, but then there's a lot of other things that come after that. And disease management, tracking, getting therapies and stuff sent to you at the push of a button. This is what we want to do. And then
Okay.
for DocoSun, and then for us too, like we also want to expand to multiple countries, and we want to showcase Vietnamese tech innovation around the world.
Okay. So I think last question then. Do you have any, it's been what, over a year since you've been working on Docosan, but do you have any like anecdote in particular that you find illuminating or interesting or surprise you from your time either building the company or working with it?
Sure. So I think like my favorite thing working in DocuSign is reading patient reviews. Actually, every single time we get a positive review from one of our providers of the service, like I'm so happy. And so I can tell you about something that happened this week that I found really touching. So there was a woman who was one of our really early users from when we had first launched the service. And we didn't even have a lot of doctors or anything then, but she had been seeing some of our OBGYN doctors for fertility treatment. So she was really trying to get pregnant about a year ago. And so just recently she shared a review, and she shared it not only on DocuSign, but she was posting in some of the Facebook groups to tell others that she was pregnant, and she also had like a really positive review of her now OB/GYN who's going to help her through the pregnancy process, who she also found through Docosan. And so I thought that was really great from when she was looking to getting pregnant to now being pregnant to, when she has her baby, and then hopefully finding healthcare throughout that child's life. I hope we can be her partner in that.
Yeah, that's great. That's awesome. That must be really, really rewarding because I know you put a
Yeah.
lot of work into this, and your team
My
does as
God,
well.
yeah.
um, yeah. Well, again, thank you so much for joining me. I know we're both working from home, so don't know how much longer that's going to go on, but um, yeah, I mean, stay safe and healthy and all that, and hopefully this will end sooner rather than later.
Thanks so much, Mike. It was great talking to you.
Yeah, you too.